It's great to be back here at the CES Digital Health Summit. It's a real honor, and I'm excited to talk to you this morning about the incredible activity that we saw this last year in digital health funding, as well as share a few thoughts about what we can expect to see in the year ahead. But before I get started, I want to tell you about a little girl named Sophia. Sophia's parents didn't notice that she had a vision problem. Even her trained pediatrician thought her eyes looked normal. But like 1 in 4 children in the United States, Sophia suffered from a vision impairment, commonly known as lazy eye. It's a disabling condition for children around the world. It's the leading cause of blindness in children and also a source of learning disabilities. And with 70% of children with vision impairment under the age of 6 not receiving a diagnosis, in large part due to the prohibitive cost of today's technology, Sophia was lucky. When Sophia was just 2 years old, her pediatrician's office used an innovative digital health tool called Go Check Kids to test her vision at a regular well child visit. Using photo screening technology, a nurse tested Sophia, identified her lazy eye simply by taking her picture on an iPhone. From there, her pediatrician was able to address the condition through a simple pair of eyeglasses. Go Check Kids was one of the many digital health companies funded this past year, and in many respects represents the promise and the possibility of digital health care. So here's the headline for 2019. Although funding dipped slightly relative to 2018's record-breaking year, 2019 still represented the second largest year ever for digital healthcare financings, with over 1/3 of all healthcare venture financings involving digital health technologies. Over the next 10 minutes or so, I'm going to take you through 3 things. First, we're going to look at where the money went in 2019, who got it, how much they got, who spent it. Second, we're going to look at deal activity in 2019, paying particular attention to the capital markets activity, which was incredibly strong for digital health companies. And third, we'll close with a few predictions about 2020. Before I do that, I want to introduce myself quickly in Cooley and talk a little bit about the companies that we work with. As Jill mentioned, I'm a partner with Cooley. I primarily work with high-growth companies and technology-focused industries. I also represent the venture capital funds that finance those companies. I spend a lot of my time assisting clients with their financing and commercialization activities, and also guiding them through transformative events like an M&A transaction or an IPO. I also come from a family of clinicians, and healthcare has always been a part of my life. It's something that I'm passionate about and feel honored and privileged to be a part of. As for Cooley, we're a new economy firm. Our clients are driving technological innovation around the world. We have the leading venture capital fund formation practice. We also boast premier practices in the technology and healthcare and life sciences industries. We have the #1 firm for IPO and venture financings, and we represent over half of the companies listed on the NASDAQ Biotech Index. Our experience working with healthcare and tech entrepreneurs puts us in a unique position as these industries continue to converge. And we've had a dedicated digital health practice for over 10 years now. And over that time, we've seen some incredible growth in the industry. This is a summary of financing over the last several years put out by our friends at Rock Health. This actually just was published about an hour ago this morning. It shows total funding on the left in light green, which last year approached nearly $7.5 billion. And in dark green, we see the number of deals by year, which, while dipping slightly relative to 2018, still represents a very, very active market. We also see across the bottom average deal size hovering around $20 million or so. And while that in no doubt is skewed to the 10 or so mega deals that we saw last year, even backing those out, we're still seeing very large funding rounds. And these larger financings are consistent with the general trends in venture right now, where investors are going bigger at all stages, primarily intending to scale quickly and accelerate growth. And regarding the mega deals that I just mentioned, 2019 had plenty of notable ones representing a broad spectrum of digital health These include Babylon Health, which is a company that provides remote consultations through video and text applications, which raised over $500 million. Ginkgo Bioworks, which is a bioengineering firm, which raised close to $300 million. And Capsule, an online pharmacy delivery service, which raised close to $200 million. And for those of you keeping score, there are now 18 digital health unicorns in the United States. All of this points to an industry that continues to mature, as evidenced by the number of companies that continue to raise significant amounts of money over the course of their existence, as well as the increased M&A activity and IPO activity that we've seen. To give you a sense of the extent of the growth in the industry over the past several years, consider that by 2012, there were only a handful of digital healthcare technologies that had raised in excess of $50 million. There were no significant M&A transactions and no IPOs. By 2019, the number of companies that had raised significant amounts of money or had a liquidity event had exploded. It's really remarkable how much growth has occurred in such a short period of time. And while the sheer amount of dollars and deals is notable, it doesn't tell the full story of the progress that we made in digital health in 2019. So let's quickly take a look at which sectors within the industry garnered the most or attracted the most investment. First up is behavioral health, which we define broadly to include everything from solutions that address basic mental wellness to those that treat disease. And as a sector, digital health continues to mature. We're seeing more funding and larger deals, a greater number of later stage companies, and a strong, consistent innovation pipeline. We're also seeing a strong emphasis on clinical validation. A lot of the early activity in behavioral health focused on access to care. We're now seeing a shift really based on a recognition that it's great to provide access. We've got to make sure that the care we're providing is actually effective. Two examples of this. The first, NeuroFlow. This is a company located in Philadelphia. It was started by a West Point grad, an Army veteran, that wanted to develop a technology that would make it easier for mental health professionals to diagnose PTSD in veterans. The company has since expanded and developed a suite of software products that help provide access and engagement across the continuum of behavioral health care. They're particularly focused on the gaps between provider visits. The company recently raised $7.5 million in a Series A to accelerate its funding. On the other end of the behavioral health spectrum, we have Calm. Calm is an app that guides users in meditation and mindfulness practices designed to reduce anxiety and improve sleep, something we could all use more of and which we're going to hear a lot about over the course of the next couple of days. The company recently raised almost $90 million, led by TPG Growth. Next up is women's health. And with women as the primary healthcare decision makers and healthcare workers, it's about time that women's health has emerged as a significant investment sector. And while most of the most funded companies in this space are creating direct-to-consumer experiences with patients through branded product offerings or prescription telemedicine models, we're also seeing employers taking a lead and investing in solutions as a means to improve costs and outcomes around things like fertility and maternal and childcare. A prime example of this is Progyny. Progyny sells directly to large employers. It provides resources to employees that encounter fertility issues and helps them manage treatment costs and processes. It offers coaches and technologies as well to employees and provides information with respect to conditions like treatments like in vitro fertilization and egg freezing. Progyny went public this past October in a transaction handled by Cooley. Based on our continuing work with founders and funds, we believe that the women's health sector is going to continue to garner a lot of investment and that it's just getting started. We expect to see more and more dollars flowing into this space, addressing solutions that empower women with their healthcare decisions, especially in these early stages as it relates to conditions that impact pregnancy and fertility. Finally, digital therapeutics. So I think this term, it's safe to say, has finally entered our lexicon. And what we mean by it are clinically validated solutions, programs, apps that have been cleared or approved by a regulatory agency. And while some of these complement traditional treatments by helping patients manage their conditions, such as when and how much medication to take, others offer alternative treatments to traditional drugs, such as a program delivered through your phone or a tablet that help treat insomnia or depression or substance abuse. 2019 saw more and more digital therapeutic companies crack the regulatory code. And we also saw in 2019 Express Scripts, now owned by Cigna, launched the industry's first digital health formulary, which is a curated list of digital healthcare apps and devices that is intended to provide consumers some assistance in navigating the growing number of tools available. Prime example of this is Livongo. Livongo is one of the few companies that was given preferred status on Express Scripts' new digital health formulary. And the company offers a suite of digital health programs that help patients manage chronic conditions. It's most well known for its diabetes management program, in which patients with diabetes manage their blood sugar levels. Patients use cell-connected blood glucose monitors to check their blood glucose, and based on the results, receive personalized feedback and recommended lifestyle changes. Livongo also went public this last year. So who's investing in digital health? This slide gives you a sense of who the major players are. And at this point, the majority of investors in digital health companies are repeat investors. And although we see new investors entering the mix each year, it's safe to say that the group, I think, that has dedicated itself to this has arrived. What's interesting, I think, about this mix of investors is that while we do see some traditional healthcare funds up there, we also see some traditional life sciences funds, as well as those from the tech world. We've also seen a number of growth equity funds, which typically invest at later stages, moving downstream and investing in digital health technologies at an earlier stage than they typically would. Corporate venture was also particularly active this last year, including on the payer side. So the flow of capital to digital health companies coincides with an increase in exit activity. And while there were several notable M&A transactions this past year, I think there were in excess of 100 of them, most notably perhaps Google's acquisition of Fitbit for $2 billion. 2019 was definitely the year of the digital IPO, where we had 9 companies going public after several years of drought. These companies include Health Catalyst, which provides data and analytics technologies to healthcare organizations; Phreesia, which provides apps to healthcare organizations to manage patient intake processes; Change Healthcare, which provides revenue cycle management; Peloton, which I'm sure many of you are familiar with, which provides live on-demand fitness and related services through its connected bikes and treadmills and apps. And finally, Freenome, which has developed a simple and accurate blood test for cancer detection, raising significant amounts of money. We're also hopeful that 2020 is off to a good start with One Medical filing its S1 yesterday. And so the fact that the capital markets have opened for digital health companies is great. It's great for companies, it's great for investors, it's ultimately great for patients. And so all this leads us into what we can expect for 2020 and beyond. As with the past few years, with venture funds flush with cash and the industry continuing to mature, we expect that the funds are going to continue to flow, largely driven by the continued focus on the consumer. And with digital tools and virtual interactions becoming the norm in so many situations, we expect to see a continued flow of investment into technologies and services that support tele and remote medicine. We also expect to see more interest and investment in data-driven, personalized diagnostics, prevention, and virtual health assistance. As barriers to interoperability continue to fall, the regulatory process continues to become more clear, and care becomes more integrated and less fragmented. And finally, we expect to see continued alliances between big tech companies and healthcare delivery organizations. And as we see more and more interest by venture in digital health, we'll also see more and more people affected by digital health technologies. And while the money and the outcomes matter, all of this investment has the power to affect real lives. Lives like Sophia and others like her with illnesses and conditions that can be better diagnosed and managed with technology. And for everyone here as well. We're excited about the year ahead and what the opportunities hold. And like Sophia, we're looking forward to seeing more digital health innovation in 2020 and beyond. Thank you.